Welcome to today's live with SOTZIM trustees as well as the guests. I would like to introduce you to our amazing moderator. Her name is Mucha Nyandoro, and thank you so much for agreeing to moderate this, Mucha.
Thank you very much for that introduction, Karen. Right, so everybody, welcome to our first live session. As you heard, my thinking in this battle against COVID-19 is that we have this enemy whose strongest weapons are fear, intimidation, destruction. And in order to be effective, we obviously need strategies and tactics that work. So we have an amazing panel of generals in the battlefield against COVID-19. And you'll see from the panel that we have Tariro Makadzange, we've got Rezana Ebrahim, Shingai Mutasa, Mucha Mukanganwi, Busisa, Moyo, and Darlinton, Masenda. Thank you all very much for joining. I'm looking forward to the next hour of chatting to you all. Right, so I am going to switch things around. We had a little bit of a plan, but Darlington, I'm actually going to start with you because we've had lead very nicely from Karen around fundraising and hospital build-out. Could you let us know what's happening with St. Anne's?
Good. Thank you, Mucha, for having us on, and welcome to everyone. First of all, I want to start off by saying I'm fully Zimbabwean. I love our people. I love our country. We have a beautiful country. We have beautiful people, and we want to hold on to them. So if we're going to do that, we have to, all of us, come together, put all the resources, every little bit of resource that we have, put it together and fight this thing. And I know we're going to win. So go Zimbabwe. Let's do this now. After saying that, Mucha, I just want to quickly talk about St. Anne's. We're putting together, obviously, Solidarity Trust Zimbabwe and St. Anne's have come together. We're reawakening a hospital that's been sitting there for a little while. And we are at the point where we're about 70% complete, ready to open. We've had to do quite a bit of work to get ourselves ready. But I can tell you that we are going to have an ICU that will have 7 beds, a CCU that will have 4 beds, and an HDU that will have 17 beds. And then the rest will just be general beds, providing oxygen, providing general care so that whoever's needs to be in that hospital can be taken care of. And we're ready to go. We've just finished doing we've just started doing some recruiting. We have excellent doctors. Our clinical director, Dr. Gede, is ready. We have doctors like Dr. Reed. We have anesthetists. All of these people are ready to give you the best care that you would ever imagine at this time. And our hospital is ready, guys, and we're ready to take care of you guys. So we'll be opening soon. We're looking to open around next week, if everything goes well, but we still need those contributions, those donations that you can give us right now, just to help us get to where we want to go.
Darlington, there'll be a segment of people who assume that St. Anne's is an elitist hospital by virtue of its location and the bodies behind SOTZIM. Could you reassure the Zimbabwean community that it isn't?
Good point, Mucha. The reason why we came together to do this was simply that we're all different Zimbabweans coming from all walks of life. And the reason why we came together is that because we love our nation. And so we love every single Zimbabwean that's out there. So this is going to be a place that's going to treat the public. Anybody who's suffered the misfortune of catching this virus will be welcome to be treated in this place. There'll be no segmentation. We will treat anybody and everybody. It's a free service, and we're coming to make sure that everybody's taken care of.
Thank you, Darlington. And Busisa, how does that compare to Bulawayo?
Thank you very much, Mucha. We are still quite a bit of a distance away. We're not looking at next week, probably 3 weeks, with your support. And thank you for having us on the program. On SOTZIM, there are 2 directors that are based in Bulawayo. That's myself and Mr. Heath Streak. And we are obviously looking at a facility here called Egusileni Joshua Mkabugonkomo Hospital, which is a 200-bed unit. And we are starting off by kitting it with 50 beds. That's what we are looking at. We are still a long way off, but we've managed to get a medical director, a medical superintendent in charge of the hospital. And we've managed to put an oxygen tank and get it oxygen ready. The system is being tested courtesy of BOC gases. So that is currently going on. This was a hospital set up by Harvard Business School 25 years ago, but nothing has happened there. It is a shell, Mucha. There is nothing inside. And what we are doing is we are kitting it up, putting beds in there and getting it to a functional state. And we're looking at 50 beds to start off with, but it has a capacity of 200 beds. So we very much need your support from Zimbabweans within Zimbabwe, in the diaspora, friends of Zimbabwe, people who love our country. Thank you.
And of course, Bulawayo being in close proximity to South Africa suggests that infection rates or contamination rates there might be slightly higher. So it becomes that much more important to ensure that we are ready for treatment. Absolutely,
Mucha. Bulawayo is probably going to be the epicenter of this virus because we are a root city. People from Botswana making their way to Harare. We also have a large diaspora contingent historically. So when the South African lockdown happened, a lot of the people that come from here made their way, and you saw those pictures roundabout soon after President Ramaphosa made the announcement. It was an announcement made with a 4-day runway. After that announcement, people started to make their way back because they realized in South Africa they weren't going to be able to survive a lockdown because some of them are living in very difficult conditions. So what did they do? They came back home. And so we have a lot of people that came across the border. We also have deportees now reaching almost 1,000 that came out of Botswana who are in the city. And so the probability of infection, once testing starts to happen at the level that our government is envisaging in the next couple of weeks, we are going to see Bulawayo most probably surpassing in terms of infection rates and the number of people infected with COVID.
A beautiful segue to you, Tariro. On testing, you are in a prime position as an immunologist to understand the trends globally around the character, if you like, of COVID, and initiatives around testing and ensuring that populations are kept safe and know what their medical profile is. What would you describe as the most efficient, or what do you see Zimbabwe assuming on the testing front?
Yeah, thank you, Mucha. I think that's a really important question and a very challenging question. So as everybody knows, COVID is caused by SARS-CoV-2. This is a new virus for all of us globally. None of us have seen this virus before. And this poses significant issues, both from the testing as well as the human susceptibility. So testing, you can simply think of it as falling into two buckets. One is testing for acute care to enable acute decision-making for clinicians, as well as, in this case, for public health practitioners. And currently, the best tests that we have for that are the PCR-based tests. So this is where a nurse or doctor, or even self-testing, where an individual obtains a nasopharyngeal or an oral swab and is sent to the lab to try and detect viral nucleic acid. So that's the PCR test. And that's what's being used globally at the moment for diagnosis. The second test is called an antibody test. So all of us, when we get infected with a virus, your immune system kicks in and makes a response to the virus and makes antibodies. Some of them, some types show up in 2 weeks, some types show up a little bit later. And there's a bit of variability in each one of us as to when those antibodies will show up. But this test will give you an idea that you have been exposed to the virus and you've made an immune response to the virus. And those are the antibody-based tests. So they will pick up people who have been infected and have made a response. Currently, there's a lot of those tests that are in development. There's a lot of them being sold out in the community. The biggest challenge with those tests is that they haven't been strongly validated. So as you may all know, every test is not perfect. And as physicians, we look at what is called the sensitivity or the specificity of the test. How good is the test at picking up people with disease? What's its false negative or false positive rate? And many of the tests that are out there haven't been validated. So we don't understand their full false negative rates. And you can imagine that would be very dangerous. If somebody has the disease and they test negative and you tell them they're okay, they go out in the community and sort of spread disease. So it's really important in the testing to make sure we have validated tests. So approved tests that are approved by bodies that have the capability of assessing and determining if the test is valid or not. So simply 2 tests, PCR and antibody tests, and validation is really critical before employing a test on a wide scale.
So if my Sawira comes and says she's been able to obtain some rapid testing equipment and I should try it out at home, what you're saying is that's an absolute no-no. It needs to be tried and tested and approved.
Yes, so only use approved tests. And those are approved by international bodies as well as our own regulatory bodies. And the ideal scenario is where that test has been validated. So you've heard of things like the FDA, the EMA, and various bodies that test, and the WHO that test and validate diagnostic tests.
Okay, so Mucha, with concerns that many might have, i.e. we're in lockdown, supply chains have been cut off, we're concerned that we don't actually have the equipment required to test for COVID-19. I know that you're quite heavily involved on the pharmaceutical side and on supply chain. Could you give us an update on what you've been doing in that space?
Thanks, Mucha. So first of all, I think what's happened is that when we started, there was a huge panic. A lot of people didn't know how product was going to move. Was it going to move? There was all the cancellation of flights. As you know, these days, the flights are half cargo, half human. So when the flights stopped flying, everybody was asking what's going to happen. Subsequent to that, we've learned that a lot of airlines have actually converted their planes to full cargo planes so that they can keep flying them. It hasn't been as bad as we thought it would have been. What has actually affected us is not so much the logistics of getting product in, but the fact that a number of governments, India, Bangladesh, South Africa, we hear the Americans are dabbling, have started to say, before you export, you need permits, or we're banning the export of certain type of drugs and products. So that really has been the major hindrance. But product is moving. You know, you can get stuff out of pretty much anywhere. And the logistics is still there.
Very good. And logistics is just that, but without the resourcing, the financing, it doesn't really amount to much. So Rezana, perhaps you could just walk us through what's happening on the fundraising side. There is obviously a requirement for a lot of funds, and we're not quite there yet.
Hi, everybody. It's a mammoth task. We've got so much money that we need. We've got so much to do. We've got PPEs to get, we've got equipment to try and source so that we can kit out all these hospitals that we've got in the country. We're not only aiming to kit out St. Anne's, we want to go across the country and try and help as many clinics as possible. That way then we can save as many lives as possible. But it all depends on how much money that we can raise. And not only money, we're looking at equipment donations. So we're asking different countries, please help us, send us PPEs. And I'm sure Mucha will agree with me, it's very hard to get the stuff in and we need the money. So that's where the issue is.
Sure. So what is it that you're requiring from society at large?
I would like to actually appeal to the business community as well as the diaspora. If you look at out of Zimbabwe, we've got between 3 to 5 million people living abroad. If each one of them gives us $10, think of what good we could do to this country, not only to fight this pandemic, but also for the future to actually improve our healthcare system, so that each Zimbabwean has access to healthcare. So that, it's so important that we've got this opportunity. Obviously, unfortunately, it's a virus that's going to kill a lot of people, but we've got this opportunity to not only fight the virus, but also to improve our healthcare system in Zimbabwe. I appeal to the diaspora especially because think about it, when we were growing up here in Zimbabwe, I'm born and bred Zimbabwean, and I was lucky enough to have a primary and secondary education that was, it actually competed with any of the first world countries. And I know that a lot of Zimbabweans living abroad can say the same thing. It's equipped them to compete and also to be leaders in the first world. So we've got to give back to our country. It's very important. And also with this lockdown, there are a lot of people in our country that are suffering. There's no money to feed their families because we've got a huge informal sector. Just today, we got a message that 400 kids in Zivaratsekwa had no food. And it just breaks your heart to see that these little kids have no food because their parents don't have the money because they haven't been able to sell their fruit and vegetables. So we really appeal to everybody to please donate.
And the UN Food Agency recently declared that we needed about 130 million to plug into food security. Shingai, perhaps you could jump in now and talk us through the socioeconomic impact that COVID is having on Zim. And of course, linking that to that mobilization of resources, the work that Darlington is doing with hospitals and Busisa. What would you describe as the current state first off? And then the second half of my question is, what can we contribute more towards besides financial support?
Thank you, Mucha. I think, first of all, as business, we're faced with a double whammy. Our income generating businesses have stopped operating, which means we are looking after our staff, those that can, but we've got no income coming through. We're coming through a very turbulent period in the economic history of our country. So most of our companies are struggling already. So the environment is not a good environment. But one of the most important things that we are telling all our stakeholders is that there is life after COVID. And it's important for us to remember that as business. Secondly, we have to look after our people. We've got to figure out how, at the end of this, we have as many of our people able to operate as they were doing beforehand. And therefore, we're faced with this dichotomy of there needs to be significant capital raise to assist great initiatives like SOTZIM, while as business, you're planning and strategizing about tomorrow. But at the end of the day, it's about how do you contribute? Yes, a lot of us are talking about money, but there's so many other ways we can contribute to this initiative. Time. I mean, I look at what the trustees and the support staff around the trustees are giving in terms of their time. It's phenomenal. If we could duplicate that throughout the economy with those who have the ability to contribute time, that in itself is massive. Food, those of us who are in farms, who are producing product and suddenly have no way to move that product out of the country, maybe it's better to see it moving into food banks to assist the disadvantaged communities. But at the end of the day, the more cash we can contribute, and as Rezana has just said, $5, $10, $1, it makes a difference. But I think we have to, as a society, both in Zimbabwe and out of Zimbabwe, have to look to ourselves before we look to other people. And we have to show other people that we are committed to our own. And that's why even if you're giving $1, that for me is a statement of intent. And we should not frown on that. Obviously, if we can put more, give more, $5, $10, whatever the number, I think is really the thing that is going to turn the curve. One of the biggest issues that I think we have been discussing as business is the reality is we don't want to get to a point where we have to send people to St. Anne's or to Wilkins. So we have to put more and more energy into preventive. And that, I think, is where a lot of people can help the society. So those, for me, are the key takes at the moment.
Very good. Tariro, on the issue of containing COVID-19. I think there might be a misperception that because sub-Saharan rates are quite low at the moment, it's everybody else's problem and it may not really get to us as it has in the West and elsewhere. What would you say from a medical standpoint around people's sort of duty of care to society?
Yeah, I think one of the things that we're learning is that we don't have treatments for this virus. So the public health component is going to be really, really important. And it's actually when you have a small number of cases where you can make the biggest impact. So in public health, we talk about containment and mitigation. We're all aware what happens when there's TB, for example. Your public health system kicks in, identifies the close contacts, tests the close contacts, and treats the close contacts. You can do that when the numbers are small. So for COVID, a respiratory virus, so spread in a way that things like typhoid and cholera aren't. It's spread in the air through airborne. It's really important when you have a small number of people infected to identify the close contacts who are at risk, contain those individuals and treat them appropriately to mitigate the spread to the wider population. Once you get to the point where you have a large epidemic, so for example, in New York City or big cities in the West, it becomes much harder to do the standard public health containment activities. And that's why you hear them talking about let's flatten the curve and decrease it to the point where you can bring in your public health warriors who can do the contact tracing mitigation and limit subsequent spread. So in sub-Saharan Africa, we actually have an advantage as well as a slight disadvantage, but we have an advantage at this point in that the numbers are small, that we can do good containment measures. And we're also blessed with a good public health system. So if you look at the city of Harare, the city of Bulawayo has the same thing, where clinics have these environmental health technicians who know every single household that has a typhoid outbreak and can identify those households and lead them to appropriate care. We should be expanding programs such as that to help with the containment of COVID. And we have the advantage that we already know how to do things like that pretty well and at relatively low cost. So in some sense, that is one of our advantages, small epidemic and already a system that's very well aware of infectious diseases and how to contain and mitigate infectious diseases. Our biggest challenge is the overcrowding. So in the townships, if you in Mavuku, in Bare, where you have a lot of people in a very small space and a very tight space. And we know that in China, as well as in Europe and North America, a lot of the transmission has been in close household contacts. So it becomes really critical in places that are highly dense to make sure that you have in place procedures to help isolate the infected individuals and minimize the spread within a tight community. So certainly advantages in that the epidemic is still relatively small, and disadvantages in that we have sort of structural issues, poverty-related issues that mean that we should be thinking about and planning for this now before it gets too out of control for containment measures.
Very good. Thank you for that, Tariro. There will be people out there who are curious to know why you've decided to get involved in SOTZIM and what space you've carved out specifically for yourself. So Darlington, maybe you could talk us through your motivations behind the work you're doing.
Right. Thanks, Mucha. I think that, for me, as most of my colleagues have mentioned, it's important, COVID is something that will come and will be here with us, and then after a bit of time, it will be gone. But what it creates for a nation like ours goes beyond the illness. It goes beyond. It just shows that our nation has got so many resources, whether it's intellectual property, whether it's the minerals for us to be able to do our own thing, but for us to be able to come together as a nation, to send out a call. I just say, Mucha, there's no time, such a time like this, for us as a nation to come together when we've got these type of challenges and to be able to go out there and do what we need to do. Now, on average, at St. Anne's, we're doing 10 to 12 hour days, just making sure that everything is in place. For us, got people who are working the phones with the call center, which we may touch on a little bit later, but the call center, people are on the phones. We're getting lots and lots of phone calls. All these things are important for us to remember when COVID is gone, that our nation can rebound, our nation can come together and fight as one nation, and unity can be created out of that for us to go forward. We can do it. So it's important for each and every one of us to take the first step. I took a walk into and you know, it's interesting, Mucha, when you walk in town and then you say to somebody, oh, I'm doing stuff at St. Anne's, and then they start moving away from you a little bit, you know, because they're kind of worried whether, and you explain to them, say, no, we're still preparing. We're not taking patients, but even for us, we're part of the front line, but it's important for somebody to do the work and do it now. As Doc has just said, you know, let's prepare, let's be ready, and we'll lose a lot less people.
Mm-hmm. And Busisa, we're fighting a battle from two different standpoints. On the one hand, we've got COVID, and then we've now got malaria. In terms of readiness to deal with these multifaceted enemies that we're facing at the moment, what are you seeing in or around the Matabeleland space that you're working in? And what would your advice again to people be around health concerns? i.e., this is where I suppose the call center comes in handy, but what would you recommend for people who are feeling a little bit defeated by it all?
Well, I think that this initiative that we are involved in here illustrates the need to have done this a long time ago. We should have all gotten involved and been concerned with the status of our health sector. COVID is merely highlighting to us that we had a huge deficit in our medical and biomedical space and sectors. And we should have really, to be honest, Mucha, we should have been paying attention as corporates, as part of whether corporate social responsibility, as conscious capitalism, however you'd like to put it, we should have all gotten involved. And now this pandemic is basically getting us into an emergency mode where we start to tackle these health issues. And you're absolutely right. We have to look beyond just COVID, and because there are other conditions. And for myself, it's been enlightening. We talk of Egusileni, but I was at Thorngrove Hospital, which is just 5 kilometers from where I am here in Kelvin. And the situation there, you know, but I've driven past that hospital and I blame myself. I'm starting with the man in the mirror to say we should have paid attention. We should have mobilized. And habitually going forward, we need to pick up a new habit, a new psyche about these key infrastructure items like our health, because we can have prosperity, but if our health is not secure, we are not going to go very far. Our workers, I'm sitting in a factory that employs 500, 600 people. God forbid one of them should have a condition, COVID, malaria, as you mentioned. It will affect productivity. And so we as Zimbabweans have to secure our health sector for the good as a baseline to prosperity. And I think that's the thinking that we need to carry forward. That's the big lesson in all of this.
And Mucha, I would imagine you're taking a lot of these lessons and they've informed the structuring of SOTZIM, i.e. the need for collaboration, the need for consciousness around the state of things like our healthcare system. What would you say is the primary driver from your personal perspective for getting involved in SOTZIM and all the work that you're doing?
Thanks, Mucha. You know, when this thing started and the numbers started to come up in Europe, and, you know, you start to think about your own people and really how vulnerable we are. And, you know, when borders started to shut, and, you know, you just, there was a need to do something. And when this thing started, you know, we didn't even really know what you could do or couldn't do. And as time progressed and you start talking to some like-minded people and realize that actually there's quite a lot of people who want to do something, who want to help. And then for me, once I got to that point, I found that very empowering because, you know, before that, it was just you're living in fear. You're living in fear for yourself. You're living in fear for your parents. You're living in fear for your kids. you're living in fear for your fellow Zimbabwean. And then when you move to, okay, let's get to a space where we can do something. And it's been very entrepreneurial, because I promise you, when we started, we really didn't know what it is we wanted to do. But every hour, every day that went by, we started to crystallize what we could do. And I think it's been mentioned by a few guys. It's been quite remarkable what we've been able to achieve when Zimbabweans put their minds together. And also we positioned ourselves, I think, very well as a trust. So our trust, you use the word collaboration, and that's actually in our documents. We want to collaborate with everyone. We want to collaborate with government. We want to collaborate with other initiatives. We believe there's room for everyone. So let all the flowers grow. We'll put them together into a beautiful bunch. So I think the reason I've been involved with SOTZIM is because I wanted to do something. The reason I've stayed in SOTZIM and stayed committed is because I found it very empowering to be able to do something and give back to my fellow man.
And Shingai, would you let us know what your motivations are and what participation you've seen perhaps from the more marginalized sectors of our society, i.e. the space that they're occupying in the fight against COVID? So you've got a group of businessmen, of people who are in the position, if you like, to make a tangible difference. But equally, there's that person at Ukumusha who's thinking, well, besides washing my hands and staying at home, what role can I play? Perhaps you could touch on those 2 points for us.
Thank you, Mucha.
They're quite unrelated, I get this, but there's a logic to this.
I think in terms of that person, whether they're in the village or they're in the high densities, or at the core, it's about social distancing. And just educating the next person properly is a big thing. You see, I think we should be focusing on small incremental wins. And if we get our society to focus on those small incremental wins, I think we'll win. But at the core, for me, what Mucha said is, I think as a society, we've been battered, we've been bruised, and we no longer believe. And it's only when you get a group of people like this, when you start realizing, actually, no, yes, it's been a very painful period, but we have a great country. It has so much potential. And we, as the custodians of this country, have to become participants. I think the issue with regards to COVID is it just narrows our focus to a particular point. But when you think about all the disasters that are going on in our country, water, when you look at the bad roads, most of this is a sign of absolute anarchy of the Zimbabwean person. Because we're always saying, well, government should do it, or the municipality should do it, knowing that they have no capacity to do. And I think what SOTZIM is saying is, we understand that the Ministry of Health has limitations. So let's do something about it, rather than just sitting back and saying, look, they're failing. And I think, to me, that is really at the core. If we can energize Zimbabweans in Zimbabwe, outside of Zimbabwe, to participate in that realization, I think we'll go a great way towards rescuing our country.
Sure. And I actually see that we're at the cusp of a cultural shift that says we're not sitting and waiting for somebody to take care of things that we can do for ourselves. So it's really quite a potent statement that you've made by creating SOTZIM. And I'm hopeful that other groups will be inspired to follow suit and think about what they have capacity to do, how they can go about, utilizing the range of resources at their disposal, and really start driving change, because it's much, much needed. Rezana, would you be able to opine on the call center model that we've implemented in Zim and how that's operating?
Actually, that would be Darlington's side, but I can give you some information. That last week on the live chat, Karen and the rest of the trustees announced that that's what their plan was, to take over the 2019 hotline. And on Thursday, they started training the doctors and the nurses. And within a few days, we were already live, which I have to say, it's so commendable to see how we're not just speaking, we're taking action.
Sure.
And that's what I have to say is, with all our trustees, everybody that's involved, we're all fighting. We all know that we have to do this. We have to get together. And another thing I just wanted to say, though, is I spend most of my time outside the country. And I can't tell you, every Zimbabwean I meet abroad, their heart is still in Zimbabwe. They would love to come back one day. And if you even drive just outside of Harare towards Norton, etc., you will see these huge homes being built by the diaspora, because their dream is one day we are coming back to Zimbabwe. And that's why I'm saying I appeal to my fellow Zimbabweans living abroad, that this is your time also to participate, get involved, help us build our health sector, help us save lives, because one day you are going to come back here. Okay. And you want to be able to come back, visit your family, and know that if something happens to you while you're in Zimbabwe, you've got good hospitals that you can go to. So please, after this live chat, we've got a little section there where it says donate. I plead with everybody to please donate and please help us.
And we all keep saying that for every dollar that's donated, that is a life saved, right? So yes, that appeal is at the heart of most of us here. Darlington, on the call center, I do want to drill down a little bit on this. For there are people who may not know that it exists, who are hearing for the first time. What is it?
All right, thanks. The call center is something that we've set up as part and parcel of the solution that we just thought would be good for people to find out information. You keep hearing about what COVID is, what it's not, what can treat it, what can't treat it. And if somebody is got symptoms that suggest that they may have caught this virus, what do they do? So they'll call into that call center. And once they call into that call center, we've got 66 doctors that are there 24 hours a day. So you can call at any time of the day or night, and somebody will answer your phone call. They will go through the symptoms that you're experiencing. They'll go through where you've been, and so forth. They'll ask the pertinent questions that will really then give them an idea of what should happen after that. If they feel that from what you're saying, if their experience will tell them that they need to send somebody to where you are to test, or you need to talk to a doctor who's more experienced after that, they will make that call. But at least you've got somewhere where you can talk to somebody and know that you can get help. That is the most important thing. There have been so many calls coming in. And so for us, that gives us comfort that at least people are getting help. And that is what we're trying to do. Now, it's important for me to say, Mucha, that you've got 66 doctors. We need to find ways of continuously keeping them going, whether it's airtime, whether it's just for them to fuel to get to wherever they're going or whatever. So we need to also raise money for us to keep that call center going. So again, you're going to hear it from me. Please, if you can put in $1, you can put in $10, put $100, to put $2,000, we'll take it. It's all for the good. I also wanted to say this, Mucha, it's important. People will always ask, where's our money going? And maybe you're going to ask that question. So I'm just going to jump in and answer it. But I feel that it's important for me to answer that question. We are taking the money that we're putting in there and improving facilities, whether it's in Bulawayo, whether it's in Harare. We'll actually have people that can show you this is where your money went. We're buying compressors that are in need for extraction, compressors that can put free air into areas where the CCU is, where the ICU is. We are making sure that we are putting one-way traffic where doctors will don in one place and then doff in another place. That means where they'll dress in one place and then we'll take off the clothes that we're wearing in another place. All that takes planning, it takes time, and it takes money. So please, please, please send in your donations so that we can keep this thing going, make this experience one where we can say we overcame. We
overcame and we sustain, I hope, after all this is said and done. We want a sustainable model.
Just on to Darlington's statement. What's really important and what all Zimbabweans and foreigners need to know is that we are audited by PwC and EY. So there's no way that your money is going to be used in the wrong way. So that's what we will assure you, that we are going to use your money to build the facilities as well as feed the needy Zimbabweans. And we will be audited by reputable accounting companies.
Well, you've heard it all, people. All accounted for, checks and balances in place. So please do make your donations. To close this section, I wanted to do a rapid response exercise with all of you. I am a bit random like this. So if you could tell me just the one thing you'd want our audience to remember from today's call, that takeaway that is going to, as I keep saying, save a life. What is it? Free for all. Who wants to go first before I start picking?
Do whatever you can. Don't wait for somebody else to do it. Mm-hmm. Take the first step. Put in some money, put in some time. Just commit to do something, and you will see it will show results.
Very good. Thank you, Darlington.
We've got St. Anne's, we've got Heat Streak. I mean, if you want to talk about the glory days of Zimbabwe, what else can you ask for?
I think it's important for everybody to realize that that person who is going to need that hospital bed could be your grandmother, could be your son, could be your sister. And think about it. What would you prefer to have? A bed because you donated $1 or nothing?
Very good. That is most potent indeed. Tariro.
So thanks. It's a bit hard to follow the glory days of Zimbabwe example, but that I think what I would say is, COVID is real. It's a virus. It's an infectious disease. Don't be afraid, but be informed and seek the right information. We don't have treatments, but we're globally working to actively find solutions, both therapeutic solutions and vaccines. But please be informed with the right information. There's a lot of information out there, but the right information, feel free to touch into the information center, but stay healthy and stay well informed.
A penultimate statement from Busisa before I move to Rezana.
Thank you, Mucha. Thank you for putting me on the spot. I don't know whether we will be able to help everybody, but I know this: everyone can help someone. Every one of us can make a difference through the smallest donation will make a difference to someone.
Bravo. And last but not least, Rezana.
We are very lucky that we've got a very highly educated population. So our work is not so difficult, because we can tell our people, wash your hands with soap and water. We can tell them, don't run to the hospital. There's so much that we can tell our population, and they understand us, and that's why it's easy. We just have to get together and unite. And as one of the panelists said earlier, there are lots of initiatives out there. I appeal to every one of the initiatives to let's join forces and let's fight this together.
Okay, very good. Before I circle back to you, Karen, I just wanted to say it's been an absolute pleasure talking to all of you. I come back to my analogy of us being in warfare, and everyone has got a rank in the army. So please do find yours, define it, run with it, and do make the best of whatever resources you have to hand to make a tangible change and difference in this fight.